The Food and Drug Administration is investigating a multi-state outbreak of infant botulism linked to baby formula after another case was confirmed. The FDA says 4 cases have now been reported in California, Pennsylvania, and Washington state between April and May. 3 of the infants were hospitalized. According to the agency, they had consumed Nara Organics whole milk organic powdered infant formula, which was recalled last month. The formula was sold nationwide at Target and online at Nara.com. Now, the company says it is, quote, saddened to hear that an additional case has been added to the investigation. The company added further testing of its products were underway, and it is cooperating with federal and state officials. Infant botulism is a rare but serious illness caused when babies consume bacteria with spores that produce a toxin in the gut. Symptoms include constipation, poor feeding, and weak muscle tone. For more, let's bring in CBS News medical correspondent Dr. Céline Gounder. She's also the editor-at-large for public health at KFF Health News. So, Doctor, last December, there was another infant botulism outbreak tied to a different formula brand called By Heart. That led to more than 50 illnesses in 19 states. What's happening here?
Well, the FDA now confirms that both Nara and By Heart used the same milk supplier and the same drying plant. This doesn't prove that the supplier is the source. No sealed can has tested positive yet, but it's why investigators are looking upstream at shared ingredients between the 2 companies.
Formula makers aren't required to test for the bacteria behind infant botulism. Why? And could that change? Should that change?
So the FDA makes companies test finished formula for 2 bacteria called Chronobacter and Salmonella, but it doesn't require testing for the spores that cause botulism. And during the By Heart outbreak, I spoke with a number of different labs and other experts, and they told me why. So the botulism spores are so sparse, you'd actually have to test hundreds of grams of powder to find them. So it's not so easy to test for. The landscape could change, however. There's a bipartisan bill, the Infant Formula Safety Modernization Act, that would require botulism testing in every plant. And even the FDA has asked Congress for power to make companies report a positive test, because right now, if the formula hasn't shipped, they don't have to report anything.
Wow. What should parents know?
Look, botulism is rare. It is treatable if you catch it early. As you mentioned earlier, it usually starts with constipation, then a weak suckling, poor feeding, floppy head, and droopy eyelids. If a baby seems unusually limp or is struggling to breathe, call 911. There is an antitoxin called Baby Big, and babies do recover, but it can be slow. One family I spoke with during the By Heart formula outbreak watched their baby spend 3 weeks in the hospital on a feeding tube. So right now, check labels, watch for symptoms, get care fast. And be sure, even after the By Heart products were recalled, inspectors still found some of that on store shelves. So be sure to check those labels and be careful about that.
Such important advice, Dr. Céline Gounder. Thank you.